me personally, I believe that it's going to become a bigger need because people just cannot afford the private pay cookie cutter facilities out there for the foreseeable future.
Good morning. I'd like to welcome everybody to this month's educational session hosted by Helping Hearts at Home. Today we're going to be dealing with long-term care, the continuum of care in the long-term care environment. My name is Gary Carpenter and I'm the moderator. Joining us today is Mary Jean Weber, the CEO of the St Johnland system. Okay, we have also Paul, who's the administrator of our assisted living program at St Johnland. We have Nicholas, who is the administrator of the nursing home, and Lorraine, who's the administrator of the newly licensed home care agency. So what I'd like to do is open up today's session by asking Mary Jean if you could talk a little bit about the system.
Thank you, Gary. First, I guess I'd like to give you just a quick background to who St. Johnland is. St. Johnland has been in existence since 1866, and it was founded really to take care of those that were in need by an Episcopalian minister. Over that time, we have certainly grown and changed, but our focus has always been on the needs of the community and what will benefit all that the people that we can serve. So in the 1970s, we built a 200-bed facility, which was a facility that took care of those that were elderly. Over the years, the things have changed, and as I said, as our mission has remained constant, we, however, have moved with what the culture and the environment needs. So during that time, we have established a traumatic brain injury program, which takes care of 22 people that have had traumatic brain injuries. We have a dedicated dementia unit of 50 beds, which take care of those that need specialized care and dementia treatment. We have a subacute unit, and then we have a general nursing home. In our environment, we have an adult daycare program, which did close because of COVID, but we're hoping to open within the next few months. So St. Johnland has always been an organization, though we are an independent organization, that has tried very hard to meet the ongoing needs of the community, always while being attentive to our mission, which is to take care of those people that are in need.
That's interesting.
Recently, we are almost ready to open our doors for our new assisted living program, which will take Medicaid people, which is truly a mission-driven project, but very, very needed in our community, and that will be serviced by our new licensed home care agency. So we're very excited that in this particular year, that is where our mission has brought us to be able to open those two programs.
That's good. Well, let me ask you something, Mary Jean. You and I have known each other for a very, very long time. We've worked together at Pete Marwick together for many years, and we both gravitated to different areas. You went into nursing home, I went to home health care. While you're at St. Johnland for all those years, the vision of expanding, of assisted living, licensed home care, how did that all come about, and what did you have to go through with your boards to make sure that that happened?
Well, making changes in any environment is challenging. But one of the benefits to the St. Johnland Board over the years is they really do see the needs out there and try to respond as best as we can. One of the things in healthcare is you cannot be stagnant. You need to see what's needed, where the environment is going, and try and be able to meet those needs slowly but surely. We are not an organization that says, okay, there are 5 or 10 different opportunities, let's jump on them all. We try to methodically decide what are the ones that are the best for us to do, and we believe in a strategic and a long-range plan in order to accomplish those. Our first biggest addition was the traumatic brain injury and also the KIP. That is the dementia unit. And at the time, those were done in 1995. There was just a huge need, especially for dementia, and the dementia population was underserved for what they needed. And that's really what brought us to do that. And the board, because they saw that need, was very supportive in being able to let us continue on to do it.
Very good, very good. Okay, maybe now if we can talk to
Sure,
Paul. Yeah,
sure.
Paul, if you could talk a little bit about your program.
Yes. Well, through our CEO's insight and foresight, we are opening a 70,000 square foot building that can house and have about 100 occupants reside. We offer a plethora of amenities, from inside entertainment to inside recreational therapy, activities all day long, outside trips. So we're going to be able to meet the needs of the residents in the community by offering not only services for care, for high levels of sort of personal care, but also in quality of life, in the quality of life measures.
And Paul, you said it's a new facility?
Yes, it's a
Where's
brand
it
new facility.
located, and
Sure,
what's your
yeah.
phone number?
Okay, it's we're located at 393 Sunken Meadow Road, Kings Park,
That's
Long
near the
Island,
nursing
Right
home.
next door.
and right
Yeah,
next door
right
to the
next door.
nursing home.
Yeah.
And what's unique about this piece of property is that it follows suit with the continuum of care that Mary Jean
Yeah.
was talking about. And it also allows us to work with Kelly in helping Hearts at Home in the way of our residents can see they may only need self-direction, they may only need cueing, they may only need companionship. So our community is that type of facility that will be able to utilize those services most often. But most importantly, as Mary Jean had mentioned, we are an ALP. And ALP
Yeah.
in the eyes of the state means that we accept Medicaid, which is few and far between. There are probably 12 facilities in the metropolitan area that accept Medicaid, and that amounts to about 1,500 people that receive it, and could be in assisted living while receiving the entitlement of Medicaid.
Wow, that's interesting.
So Mary Jean's foresight into that has been remarkable in saying this is still a need. And me personally, I believe that it's going to become a bigger need because people just cannot afford the private pay cookie cutter facilities out there for the foreseeable future. I think we are reaching a new time from a baby boomer standpoint. We're a different population of people, a different demographic.
Yeah, but Paul, correct me if I'm wrong, your majority is Medicaid, but you do take private.
We take private pay.
Yeah.
We're breaking it down to roughly 20% private pay,
Okay.
which will spend down and
Right.
eventually be on Medicaid,
Right.
and then 80% Medicaid.
Oh, that's great,
Yeah,
that's
yeah,
great.
yeah.
Hey, maybe if we could switch now to Nick,
Sure.
maybe if you could talk a little bit about your program, okay?
Sure. So, thank you, Gary. Nicholas Destinville, administrator of St Johnland Nursing Center. We are a 250-bed facility. We provide dementia care unit. We do have a subacute rehab unit. We have head injury unit, as well as long-term care. And we offer a variety of consultants that works within the service that we provide. We have neuropsychology, neurology, social services, recreation, occupational therapy, speech, physical therapy. And all these come together to tailor the care that the resident would need.
And your address is at the nursing home, which
Yes.
is very near,
Yes, Paul
What
is
address
my
is-
neighbor.
yeah, what?
395 Lincoln Meadow.
Wow, that's great, that's great. So literally St. Johnland Road.
Is
Yes,
St.
Catherine.
Johnland.
Yeah,
That's right.
It's St. Johnland. That is quite good,
Yes.
that is quite
Located in
good.
a beautiful area too,
Yes,
to
yes.
boot.
Well,
Yes.
well, thank you. Now I'm gonna turn over to Lorraine. Now, Lorraine is the administrator of the newly licensed home care agency. Can you talk a little bit about that, Lorraine?
Yes, sure. Well, thank you for having me. I'm very proud to be here. And I just want to say that I'm director of the Licensed Home Care Service Agency, LICSA. And our main goal is to provide healthcare services to the ALP residents right now. Eventually, I will be going into the community, but right now we're focusing on just serving the ALP. Okay, as Paul said, it's a 100-bed unit. We provide many services. One of them, which is Kelly Lanzone, we contracted with Helping Hearts at Home for anybody who needs a companion. I'm in the process of hiring certified home health aides to service the building and the residents for their ADLs, meaning their activities of daily living. Okay, meaning that if they need shower, they need toileting help, meals, they could be assisting with their meals, transferring, anything that the patients may need, the home health aides will provide. We also contracted with many companies and organizations for anybody who may need physical therapy, occupational therapy, respiratory therapy, speech and language pathology, audiology, nutritional services, and also social work if anybody needs social work. So right now, that is our main goal, is to provide the services. I can't wait to work alongside Paul and his team. We have a great team right now. Ruby, our RN case manager, Dana, social worker case manager, Kelly, our director of recreation. We're all a great team right now, and we can't wait to open our doors and get started.
That's good.
Yeah.
Well, Lorraine, you have a bit of a background with St. Johnland.
Oh,
How
yeah.
long you
Talk
been
about
there?
continuity.
Talk to us
Yeah.
about how long.
February, I'll be there 18 years. I did 15 of my years in the adult medical model daycare, which Mary Jean had mentioned, and hopefully they'll be opening up again soon. When they did close for the pandemic, I did go upstairs to the long-term care. I was an RN PCC float, and then I got a permanent position on what we discussed, the KIP unit, which was the dementia unit. It was a very challenging unit, but I loved it. And so, yeah, I'm proud to say I'll be celebrating 18 years at St. Johnland.
You know, and that's quite interesting, Lorraine, and a compliment to you, Mary Jean, is I always think there's a value to promote within an organization, to migrate a person from one level to another level. Lorraine's a classic example of
And
that.
I agree. I think that when people work with you for a period of time and gives you the opportunity to see their qualifications, the quality of the person, and that when that opportunity arises, I think that it is key to be able to keep them in your organization and to promote them for the good work that they have done.
That's true.
And I just want to add, I did contract with the Visiting Nurses Service. So, for example, if a resident needs to go out to the hospital, gets a surgical procedure, comes back, and needs a bit of a high-level skilled nursing care, that's where the CHA will come in. CHA meaning Certified Home Health Agency, and that's what VNS does. So that's another contract that the LICSA will be working with.
And you know, why don't you, since you're talking about that, why don't you talk about one of the things that all licensed agencies have to have is a QI committee, Quality Improvement Committee. Why don't you talk a little bit about your committee, Lorraine?
Well, my Quality Improvement Committee, I feel, is one great committee. I've done 3 quarterlies so far, and I have 12 members, and I've had 100% attendance and cooperation. And we discuss any kind of quality improvement measures. Right now, being we're not open, we have no patients to discuss, but in the future, that's what we'll be discussing. Any, quality of measures that we can use to improve our patient care. We have somebody from the therapy company, Therodynamics is another contract, and Jason Romano, who's the CEO, joins our committee. We have Kelly Lanzone, our committee for our companionship. I got Paul from the ALP. So we have a very nice built committee, and I'm very pleased to say that I'm happy with it.
And to be honest with you, I'm honored to be on that
And
committee
Gary,
also.
of course, Gary's on our committee too.
Well, thank you, Lorraine.
Yeah.
What I'd like to do now is introduce Kelly Lanzone. You've heard her name. Helping Hearts at Home is the biggest companion care agency in Suffolk County. What differentiates them versus other companion care agencies, it is owned and operated by Kelly Lanzone, who's a nurse, with another nurse, okay, that works alongside with her. So Kelly, why don't you talk a little bit about Helping Hearts at Home?
Okay, so my agency is a companion agency. We basically are non-touch. It's mostly a social model type of dynamic that we work with. So, and in that vein, we end up being a lot of times the first people that the elderly may meet with. We might be the first service in the home because of the need, and if they're appropriate to our services, we keep them along, and if not, we refer them out to more, whatever will work for them, whatever dynamic will work better for them. I happen to love what I do. I've worked in nursing homes and in home care, and I've done high tech and low tech, whatever. And I love this because these little tiny little things like socialization, food prep, making sure there's food in the home, making sure that there are meals out there every day and that they're drinking their fluids so nobody's getting dehydrated, that they're on cue with their PT or walking and somebody's forcing them to walk out the door and get the mail every morning. Those little things keep people active and healthy much longer and reduce frailty. So I see a big difference, and I generally do have clients that stay on a long time because we do keep them from becoming so frail that they need to move on into another, situation. Right. If there's somebody with a falls risk, we would be by their side 24/7, Our biggest catchment would be Alzheimer's type patients, where they are physically able to do whatever they need to do, but they just need prompting and they need some assistance with the eating as far as going out and, food prep and that. Like I said, we're not hands-on, so we would have to rely on agencies like Lorraine's, which you only work with your company, but we partner with other agencies to service the clients at home and make sure that they get their need met. And then, there's along with continuum of care, we have the assisted living, which is a fairly new concept, I would say, in the past 20 years. I saw the first one go up in Smithtown, Sunrise. I was excited about it when I saw it go up because I said, wow, this is really a beautiful environment. It's stimulating. It bridges the gap between a nursing home and home in a really, almost like a vacation type of a way. So the clients that are in your facility are going to be able to enjoy a lot of socialization, and even go on trips out and opportunities like that they wouldn't necessarily get in a nursing home setting where the acuity rate is much higher, and the patient is more debilitated. So that's why I loved it when I saw it open, and now that you guys are opening yours, I'm happy to see that happen. I know it's been on the table for a long time, and it's been a tough road.
Well, you were talking, Kelly, about the people that are going to go out on trips. Well, a lot of them are going to require companion aids in order to keep them safe, in order to keep them on the bus and in the
those
community.
little tiny little things.
Yeah.
It's not hanging the IV. It's not giving the meds. It's
That's
not.
right.
But it makes a big difference in their quality of life. I always think when doctors discharge you from the hospital, being younger, and if you're not on Medicare and you don't get visiting nurse, they send you home. They send you home with nothing, and they just expect it's like this void. And if you have a need for help, where does that come from? And if you don't have that help from family and you don't know to hire it, you flounder. You may end up back in the hospital, especially if you had something that was broken. So there is a complete need for it. Families aren't like they used to be. If we don't have the same family model we had in the past generation where the children could take care of the parents. It's no longer like that. A lot of the parents are alone. Loneliness and depression happen to be the biggest problems amongst our elder population right now, and it's been really highlighted with the COVID pandemic. And the damage that it's done to our seniors. And it's heartbreaking to see it, and I'm so excited to get it moving again, get everybody moving again back to where they need to be, and enjoying life, because that's what it's all about.
That's right.
You know, Kelly, one of the things that I heard a variety of people talk about is the fact that what Helping Hearts at Home, as a companion care agency, you're not competitive to anybody
No.
around this table. You support them.
Nope.
You support them, and I think, Paul, you've echoed that, you know.
Sure.
From that standpoint there, you have another nurse on staff. Can you talk about that?
Sure, I have a nurse of a clinical case management, and she goes out and she oversees all our clients. Now, our clients, we don't have a setup where you have a coordinator who doesn't know nursing or home care. The coordinator is the nurse. So anything that goes on in that home with that client, we know, and that's important. That to me is the crux of the business, for at this level especially, because somebody with home care experience that's been a nurse for a long time could walk into a home, could wade through all the myriad of different things that are going on in that home and situations, and find the truth of how things really are going, because people out of self-preservation won't tell you the truth. Husbands and wives are the best teams, and they'll cover for each other, right? And so you have to weed that out so you can give them the best care possible.
Yeah, I think that's really the uniqueness of Helping Hearts at Home, Kelly, is the fact that when you're admitting a patient, it's two nurses, one of you going out and doing that assessment, okay, to make that determination, to speak to the players around this table as to what the needs are gonna be. That makes
Yeah,
you
and
very
coordinate
different.
other needs if they
Well,
need.
that's the whole point. I mean, to be able to go from, you're gonna find residents and patients that require maybe that hands-on care,
Yeah.
more
Yeah.
hands-on care, which Kelly could refer to Lorraine, to the licensed home care agency. Or maybe Kelly's gonna see somebody that really
Right.
needs more inpatient care and refer over to Nicholas.
Like say
So-
one of my clients
Yeah.
ends up in the hospital and comes out of the hospital needing nursing home care.
Right.
The family will be talking with me,
Yeah.
and I'm gonna be
Right.
It's all
recommending
connected.
you,
It's
and
a
I have no
network.
I have no problem recommending. I've worked in St. Johnland, and I love the facility, and I know it's a wonderful facility, so I have no reservation with recommending you.
Kelly, did I hear you say you worked at St. Johnland?
Yes, many years ago.
Yeah.
We've
Did
all
you
been
know
around
Wait a-
Small world.
It is.
Well,
It is.
Your MC was on the audit of St. Johnland.
Look at
But
that.
as we always do at the end of this good session, is I always ask each of the people for final thoughts. So I'm gonna turn to Mary Jean and ask you just a final thought.
Well, I think I'd like to first just thank you for putting this together and giving all of those people that will get the opportunity to see this the chance to get to know St. Johnland a little bit
Yeah.
better. Where we are located, as Kelly said, it's a beautiful area. It's kind of in the woods. The downside to that is it's a beautiful area.
It's a beautiful ride.
So people don't really, even if you come from Kings Park, you don't necessarily know that we exist. So this will give us a little bit more publicity out there, just to let the world know we have all these specialties, and our job is to try and help you and to keep you there.
Wow.
And Gary, it's been a wonderful opportunity, and thank you for putting it
Well,
together.
thank you. Now I'm gonna
Yeah.
turn to Paul.
Well, I echo Mary Jean's sentiments, and I thank you as well, and I thank you, Kelly, as well. But I'm very proud to see this multidisciplinary approach to care. That, to me, is the biggest part of all of this. That's what makes it all worthwhile, is that from from beginning to end, the patient/resident is going to be getting taken care of. And I think that that's the most important thing that I could talk about today.
That's
So
great.
thank you so much again for having me.
Well, let's see. Lorraine?
Well, being a nurse for 40 years and doing a lot of different field work and home care and nursing home, I'm really eager to start this next opportunity for the ALP and for the home care services that I'm going to provide for them.
Great.
And I thank you again for having me, and good luck to everybody.
Thank you, Lorraine. Thank you.
All right, Gary, Kelly, thank you so much for the invite. This was great, by the way, and it's an honor, to even be part of this because, St Johnland has been around a long time, and just to see how, the different buildings are growing, the services are growing within the network, and being able to work with you, Kelly, in collaboration, and this is great. I think this is what healthcare needs. It's all about connecting the dots. So
That's good.
Absolutely.
Kelly? Closing
I
thoughts?
want to thank everybody for coming here and taking your time to explain your program
Thank you.
to the public and to the people around us. And one of your probably your only detraction is that you are far away from the main roads, and you're not in the forefront of people's minds when they think of a nursing home or anything. But you have a wonderful program that
Thank
stands above many others that people could choose from. And I
We
always
appreciate that,
Yes.
thank you.
you work hard for it. I know you do. I've seen you do it.
And
It keeps us busy.
Yes, it does.
Kelly, as it might be far for a nursing home, but I have to tell you, it's been a very big plus. You see all the deer.
Yes. And you're right on the bluff.
The
You're right there by the
residents,
bluff.
Excuse me, yeah.
And I
go
think what people forget is we are right off of Sunken Meadow Parkway. So, we are what, a mile off the parkway, so
That's
even
true.
though
You
we
take it to the
seem like
last
we're so
exit.
far
You
away.
have to take
Right.
Sunken Meadow to the last
That's
exit.
right. We are really connected from the South Shore to the North Shore easily.
Yes.
A lot easier than you kind of think, because when you have a major roadway, that's a real plus.
Oh,
But
right
you kind of
there.
don't think that.
Right.
Oh, that's good.
right.
Well, as we end, I always like to say, number one, thank you to our participants. Thank you, Mary Jean, Lorraine, Nick, Paul, and of course, Kelly. We do these on a monthly basis. Next month, we're going to be doing this type of interview on the focus being Alzheimer's dementia. So I look forward to seeing you all next month. Bye-bye.